Hi, everybody. This is Dr. Brett Talley Daniel, MD. This will be my 10th podcast in the migraine area dealing with the subject, Amitriptyline for migraine prevention. So, Elavil, or now commonly called by the generic name Amitriptyline, came out in 1961 and is now one of the oldest drugs used for migraine prevention currently. Although originally intended for treatment of depression by the FDA at doses of 75 to 150 milligrams at night, headache doctors successfully use lower doses such as 10, 20, 30 milligrams taken at bedtime. So, is amitriptyline a good preventive drug for treating a migraine? Yes, the American Academy of Neurology current update for pharmacologic treatment of episodic migraine prevention for adults states that amitriptyline has, quote, moderate evidence of treatment success and should be considered for migraine prevention. And they listed level B, where that's a secondary drug. Level A is a higher, better use drug. Related issues. So how do you dose amitriptyline? Well, for depression, psychiatric level treatment of 75 to 150 milligrams may have significant side effects of early morning drowsiness, a dry mouth, constipation, and possible weight gain. However, using 10 to 30 milligrams of amitriptyline at night for headache doesn't usually cause weight gain, and the side effects are much more tolerable. But early morning drowsiness may be a limiting side effect, and if this occurs, patients should try starting at a half of a 10 milligrams or 5 milligrams for a few weeks, and then advancing it to 10 milligrams. 10 milligrams is the lowest size dose they make. Or the patient can take the drug earlier in the evening, which may be helpful. That is, if the patient goes to sleep at 10 p.m., they would take amitriptyline at 9 p.m., and sometimes it's gone by the time they get up in the morning. What's the success rate of using amitriptyline alone for prevention? Amitriptyline alone, usually given at night, reduces migraine by about 30%. Amitriptyline helps with sleep also. The drug is useful for migraine patients also because migraine patients commonly have psychiatric illness such as depression, which is 50% comorbid with migraine, or general anxiety disorder called GAD, and panic disorder, both of which are 40% comorbid with migraine. Depression and GAD have the common cardinal symptoms of trouble sleeping, and amitriptyline is the only recommended drug for migraine prevention, which really helps with sleep. Another good thought about the drug is amitriptyline is not addictive. It's a Class 2 drug, and you can't get hooked on it. Class 4 drugs are narcotics like the opioid narcotic hydrocodone, which is addictive. Amitriptyline works on dopamine receptors to help migraine and also puts patients into deep levels of sleep. Sleep is good for a migraine, and many migraine patients don't sleep well anyway. Research studies on migraine patients show that they usually are in light stages of sleep. That's something you learn when you're in neurology residency. They're stage 1, 2, 3, 4 sleep, whereas stage 1 and 2 are light sleep. So patients treated with amitriptyline, migraine patients, may go into deeper stages of sleep, such as stage 3 or 4, which is good for their headaches. Amitriptyline helps also nighttime migraine occurrence. My own personal medical experience is that amitriptyline is also used for a drug for what's called nocturnal, middle of the night, or early morning wake-up headaches. It's a real problem for a lot of migraine patients. Early morning wake-up headaches are a very common problem with migraine patients, and I encourage them to keep their acute therapy migraine drug, usually a triptan, at bedside with a glass of water so they can just roll over, take the medicine, and go back to sleep. A dreadful mistake for many migraine patients is to not treat the onset of their migraine at night and then suffer a disabling migraine all the next day, because you have to treat migraine quickly within about 30 minutes with a triptan and make it work well. Amitriptyline also has a double whammy here because it treats tension-type headache also. In the headache world, 70% of headaches are tension-type headaches and 30% are migraine. The dose is a little higher for amitriptyline for tension-type headache, which is 75 150 milligrams. And migraine patients also may have tension-type headache as well. And on the physical exam of tension headache, muscle tenderness of the head will occur when examined by the doctor, and amitriptyline helps muscle tenderness. Another good thing in today's world of expensive drugs is amitriptyline is a very expensive drug. It's very cheap. Some insurance companies it's free. In Dallas, Walmart sells it for like $3 to $4, and I encourage patients to pay cash for it because their co-pay card price for other drugs or any medicine may be $20 and then get it cheaper than that. Say, for instance, Aimovig with the new CGRP drugs for migraine costs 540 milligrams, $540 a month without insurance. Also, amitriptyline is a teeny tiny small pill. And I've had adolescents who couldn't take certain pills because they were so large and what they called, quote unquote, a horse pill. Well, the 10 milligram size dose is very tiny and easy to swallow. The patient should consider staying on amitriptyline if you're already on it when you start one of the new CGRP drugs. Headache doctors started using Amitriptyline, the first CGRP drug, which has worked so well for migraine prevention in July of 2018. I used a lot of amitriptyline for that time, often with preventive drugs, which we had then, which are Depakote, propranolol, or topiramate. But I've always advised patients to stay on their previous preventive drugs when they start one of the new CGRP drugs, because CGRP drugs don't help sleeping. So then many patients may stay on amitriptyline just for sleep and migraine, help a little bit, and use their CGRP drug to really knock down migraine and cause good prevention and hopefully sleep well. Okay, so that's the end of this discussion. God bless all you patients with migraine, particularly ones who are not sleeping well, and I'll see you again on the next talk.